The federal government is showing no signs of shifting its vaccine strategy despite official modelling suggesting the focus now be on younger Australians. The Prime Minister has also rejected a Labor-led plan to offer cash incentives to take up the jab. So if financial incentives aren't the answer, what is? Joining me live is Holly Seale, an infectious disease social scientist at the University of New South Wales. Good morning, Holly. How are you?
Good. Yeah, good, thanks. How have you been?
Really good. I read some work from Dr. Nick Coatsworth just over the last few hours highlighting the vaccination rates in New South Wales, and basically that age group, 16 to 24, is getting vaccinated 80% higher than everywhere else in the country.
Isn't that such a great news story? You know, that is exactly the coverage rates that we were hoping for, and they're already delivering. That we have a population group that have self-identified as being at risk. They're seeing the news coverage where, you know, younger people are ending up in hospital, in intensive care, and unfortunately dying. And they're getting a spur to action.
We've seen, you know, let's just point out the United Kingdom. The lion's share of people vaccinated in the United Kingdom has been with AstraZeneca of all ages, and it's proven a huge success.
Yeah, look, both of the vaccines are doing exactly what we're expecting them to do in terms of really cutting down the number of people going into hospital, the number of severe cases and those deaths. You know, we are still seeing what we now are calling breakthrough infections, and that is, you know, that's fine. You know, that this is going to be the next kind of tackle ground that we deal with. In the UK, people who are fully vaccinated may still get positive with COVID, but what we're seeing and what they're reporting is very mild cases compared to, of course, what we've got in an unvaccinated population.
It's interesting, in New South Wales, we expect numbers to be a little higher today. They're wobbling around, they're going up a bit. But at the end of the day, it seems that the focus of the New South Wales government is now very much on trying to control what they can control, but push at warp speed, basically, if I can catch a phrase from the United States, on getting people vaccinated, reaching that target of 6 million by the end of August.
Yeah, look, I'd love a bit of a shake-up of the 11 o'clock teleconferences. Instead of telling us the numbers, we know what those numbers are doing. We appreciate that they haven't yet hit that peak. And so, you know, what could we instead start that 11 o'clock meeting with? How about some good news story about the number of people who have just walked into a pop-up clinic and gone and got themselves vaccinated, perhaps saying where the latest pop-up clinics are. We're having these kind of super Saturday events where people can book an appointment for an AstraZeneca vaccine at the mass vaccine clinic, and go out to Homebush and get it. And that's particularly targeted at those staff who are in workforces such as supermarkets and food and other retailers, because we know that this is where COVID, you know, is circulating. And then we need to tackle those who can't get to the mass vaccine clinic or a walk-in clinic because, you know, their work circumstances or their life circumstances just don't, you know, allow for it. And this is where, you know, I suppose the pushback is, you know, $300, yeah, you know, for some, you know, wouldn't that be lovely? Icing on the cake at the moment, but it's not what's going to help get people vaccinated. For some who can't take time off work, what about a reimbursement to those people to take the couple of hours to drive to a mass vaccine clinic, maybe a couple of hours to take time off just to go through the motions of, you know, afterwards having the vaccine and maybe feeling a little bit unwell. You know, those strategies may help. There may be parents out there or other carers who can't take the time off or have no one else to look after their children. And so, you know, having childcare facilities available, this is where we could be using our money. I'd also love to see that money go to more pop-up vans. Take those vans to construction sites, take them to workplaces, get them into the areas where young people, you know, young males maybe who just, you know, are maybe finding it tedious or hard to book an appointment. and get them vaccinated on site and make it as accessible as possible.
And look, without going into it, I'm sure that it's just as galling for you, the politics that has been playing out and some of the ego politics that has just muddied water along with misinformation. But we will push that to one side for the moment. I'd like to get your thoughts on what will happen at the end of August. Are you starting to feel more positive about what is happening, particularly those kinds of statistics that we're hearing from Dr. Nick Coatsworth, and hopefully that will be replicated around the country?
Yeah, that's it. Look, we need those vaccine figures to keep going up. And, for people to have conversations about, this vaccine and to get motivated. And for some, it may mean about travel. But we've also got to be realistic here that, we're going to hit those targets. We also got to understand what that means in our region as well, whether other countries are meeting their targets as well. And so, by August, we should certainly see a drop off, if we get to the vaccine coverage we need, of severe cases, those deaths. And that then takes the pressure off our hospital. And that's what we, need as a first step. Beyond that, of course, we're not suggesting that it's going to mean that other public health measures need to be stopped straight away. It won't be. And we will just need to keep looking to what has happened in the UK and the US and other countries with higher vaccine populations to see, what would be our step down strategy. Masks, maybe that little bit longer. And hey, look, we've worked out how to use a mask now.
It's become part of our life. Just quickly, I know I'd love to talk to you for more because there's so many areas to cover. But these vaccinations are very, very safe, aren't they? And it's really important for people to listen, watch, and read credible sources.
Yeah. And that's it. You may feel that it's overwhelming at the moment. There's so much information out there. Going and having a chat with a health provider is, of course, your number one option. Beyond that, then there are resources on the government's website and other sites where you can help break down the information about the AstraZeneca vaccine if that is causing you to have questions. There are resources now available where you can look at the benefits and the risks around not getting vaccinated and getting vaccinated, and you can look at that visually. And this is exactly what we need to do. But one of the main things right now is stopping this misinformation. And so if you have friends or relatives who have got concerns or have heard something that just doesn't feel right in the stomach, what can you do? You play a role. And so, trying to open up communication, seek permission from that person and say, would it be okay if I just ask you some questions about your concerns, and maybe together we could go and look at some information.
Yeah, and it's great. And if you can actually change what's happening around you, and lots of people do that, it helps everybody, because some tough conversations need to happen. You've got to sort of walk into a conversation rather than walk away from it. That's the world we're living in right at the moment. But some positive news around. Holly, thanks so much for coming up and getting up early for us. Love to chat with you very soon.
Okay, no worries. Thank you so much.